That. All right, welcome to the Beyond the Skyline podcast. I'm Brian Johnson, staff writer for Finance and Commerce, and I'm pleased to be joined today by Jamie Verbrugge, President and CEO of Catholic Charities Twin Cities. Jamie joined Catholic Charities Twin Cities in January 2025, just about a year ago, drawing from his decades of experience leading several Minnesota communities. Verbrugge is moving Catholic Charities Twin Cities forward in its work to provide support and solutions for people most in need. As city manager for the city of Bloomington, Verbrugge managed daily operations of the city, including implementation of its region-leading Bloomington Tomorrow Together strategic plan. Prior to this, Verbrugge served for nearly 7 years as city manager in Brooklyn Park and 5 years as city administrator in Rosemount, in addition to previous roles with the city of Egan and the city of Richfield. Jamie, I hope I got all that right. How you doing today?
I'm doing fantastic, Brian. Thanks for having me. And that sounds like an accurate summary of my experience. I think the biggest takeaway is I can't take a job or can't keep a job based on all the different places that you cited there. No, it's been a fantastic career, and I've been really gratified for the experiences I've had, and really gratified to be at Catholic Charities Twin Cities.
Yeah, well, just to start out, I wonder if you could just tell us a little bit more about Catholic Charities Twin Cities and its mission.
Sure. So Catholic Charities Twin Cities is actually the largest nonprofit social service agency in the Twin Cities region. And we do our work of serving those most in need by trying to solve conditions of poverty that challenge people to create opportunity and to advocate justice for our community with four primary lines of service. I think the two that are most familiar and most visible to the community is the adult emergency shelters that we have, as so our work serving the homeless community, and then the permanent supportive housing. We have about 1,000 units of permanent supportive housing across Minneapolis and St. Paul. The two other lines of service, children and family services. We have a Northside Child Development Center in North Minneapolis, serving about 100 kiddos. Day treatment in South Minneapolis is a partnership with Minneapolis Schools. And then our Family Service Center in Maplewood, which provides family shelter. And then our adult or aging disability services, where we focus on the elders in our community and the unique challenges that they face staying in their homes, or if they do find themselves experiencing homelessness, getting them to a place of stability. So those are the four primary focus areas of the work that we do.
A lot of good work going on there. Wonder if you could tell us a little bit more about your specific duties as president and CEO and what you've been up to in your almost first year on the job now.
Well, what I've been up to, I'll take those questions in reverse order. What I've been up to is a huge learning curve because, as you mentioned, I spent my entire 3-decade career so far in local government, right? And while there are many similarities in terms of the uh, uh, community and human focused service delivery, the nonprofit sector is very different in many respects, right? And in the city work, we have a lot of different lines of business that we provide, but primarily quality of life and the basic core functions of government. Here at Catholic Charities, especially with the emphasis on housing and homelessness, having to learn a whole new language and a whole new environment for the kinds of service that we deliver. It's a very complex landscape, right? And so it's taken the full 10 months, and I'm still learning every day. Part of that learning is going out and meeting many of the partners that we work with, whether they're government partners, both elected officials and appointed staff, meeting with our support and our donor community, um, and just getting to know those who are essential and vital for us to be able to carry out our mission. You know, a lot of the elected officials and a lot of the staff, frankly, are people that I've known from my time in city government. So going out and reintroducing myself in a new capacity. And that's also had the benefit of making sure the Catholic Charities Twin Cities is top of mind for them, right? And appreciating the work that we do within the whole ecosystem of serving those most in need. In terms of your first question about, what it is that I primarily do around here, we have a large staff. We're about 530 people, right? So, a significant part of the job is just large organizational leadership. We have a dozen different sites across the Twin Cities, right? So trying to make sure that our organizational culture and connection to our employees is consistent, is part of the work that we do through our executive team to make sure that our folks are connected to the mission of the organization, which is one of the early learnings I had, and I've really appreciated, is that almost to a person, the people who work for Catholic Charities are deeply, deeply connected to the mission of the organization. So their commitment to serving our community is really profound. And then, the other pieces, strategic planning. We've been around the Twin Cities region in one iteration or another for more than 155 years, right? So we have a really strong brand and reputation, and are recognized as a leader in serving the community. So my objective, one of my objectives, is to position us so that we're going to be around for another 150 years, right? Because I think that we're pretty vital to the landscape here, and making sure that that the community can thrive. And then the other piece, obviously, is just a lot of intergovernmental work, right? Because of the relationships that we have with Hennepin County and Ramsey County, with the city of Minneapolis and the city of St. Paul, and with the state of Minnesota, and with our federal congressional delegation. Uh, like I said, it's a really complex landscape that we're operating in, and from both a policy and a funding perspective, there's a lot of work there that needs to be done.
Well, you mentioned there's been a bit of a learning curve, but you also, as you were served as city manager for the city of Bloomington for what, 10 years, or almost
Yeah,
10
that's right.
years, I believe. Can you expand a little bit on how that experience prepared you for your current role?
Yeah, that's a really good question, Brian. One of the things that I really appreciated about my experience in Bloomington was the priority and the attention that the city council gave to making sure that the entire community was thriving, right? And so this idea that we needed to welcome all and serve all, was really an important motivation for how we did our work in the city, right? And so that took form in a number of ways, but one of the things that we focused on in Bloomington over the time that I was there was investing in housing that's affordable for people, recognizing that, for many people, especially people who are owning their own home, that's the single largest investment that they're going to have in their lifetime, right? And so wanting to make sure that people can be successful with that investment, but also making sure that the community is accessible for everybody, right? And one of the things we recognize, that the ongoing challenges of providing or having available housing that is affordable was really important to us, because Bloomington's economy is pretty diverse, right? I think we're recognized along the 494 corridor there with a strong business and corporate presence. And at the same time, we have a really strong hospitality sector, right? So kind of the full spectrum of earning potential for people who live in our community. And it's important for the hoteliers and the restaurant owners, the retail operators, that their employees have a place that is close and accessible to where where they work, right? So the emphasis that we put on affordable housing was really important, and I think that Bloomington developed a reputation as being a leader over the last 7, 8 years because of a couple of things we did. One was adopting an opportunity housing ordinance. The second was establishing an affordable housing trust fund. And that really drove a lot of investment into the community. And then working to diversify the economy even more, because I think while many people associate Bloomington with Mall of America, and to be sure, Mall of America is a really important partner and corporate citizen of the community. It's not the entirety of the city, right? And so making sure that we had employment opportunities, we put an awful lot of investment into our economic development. For example, the South Loop area is like its own little epicenter of the semiconductor and chip business in Minnesota with Polar Semiconductor, Skywater. We got a couple other businesses in Bloomington that are in that sector. And so with like the CHIPS Act, seeing those two businesses grow and prosper, we were able to attract SICK, which is a German-owned optics technology company that built their North American headquarters in the South Loop area, right? So really focusing on having accessible housing for the full spectrum of businesses operating and diversifying the economic base of the community and continuing to support the hospitality community, which is really an important piece of the city of Bloomington. The other piece that I'd say about, what I learned that became relevant for here is that Bloomington is relatively unique in Minnesota, as it's one of only four cities that has its own public health division. Because in the state of Minnesota, public health is typically the purview of the counties. In Minnesota, Minneapolis, Bloomington, Edina, and Richfield are the only four cities that have their own public health function. And Bloomington actually serves as the administrator for Edina and Richfield, right? So that piece of the human services that most other cities don't have a role in was actually really helpful for me as a way to understand and make that transition to Catholic Charities for the community that we serve.
Well, I didn't know that about Bloomington. That's very interesting. But getting back to the affordable housing issue, what do you
Yeah.
see as some of the barriers to creating more affordable housing? I mean, everybody's talking about it and the missing middle housing. I know Bloomington's been involved in that conversation. What do you see as some of the barriers to meeting that need?
That is a really complicated question, right?
Hmm.
Um, Part of it is land availability and zoning. And I think that's one of the things that Bloomington officials deserve credit for is their willingness to reconsider how they did their comprehensive planning and their zoning to try and expand opportunities for the full spectrum of housing availability, right? Across the state of Minnesota, um, having cities that would be open to doing that would help advance the problem that is pretty. And it's not just Minnesota, right? It's around the whole country. Is that the need for housing that's affordable is increasing, and especially in the built environment, it's really hard to be able to deliver the inventory that's necessary, right? And then you put together the financing that it takes to do affordable housing is pretty complex, right? And often when you do a multifamily development that is going to be at a 50 or 60% AMI, which is area median income, right? Those are challenging projects to help finance, right? And it takes a lot of different sources. So often the developers are spending a couple years pulling together the source funding because you have to get into competitive competitive funding cycles with Minnesota Housing and other providers, in addition to the local government willingness to put in, say, tax increment financing or contributions from an affordable housing trust fund. So it's really it takes a long time to get a single project done, right? So that's the other barrier, is just how complex the financing is and how much time it takes to put together. And that's at the city level. And then coming over to Catholic Charities, it is a different segment of the housing spectrum that we are working on here. And it is even more challenging to do the type of housing that we provide than it is even at a city level when you're trying to grow housing that's affordable.
Well, getting back to another conversation we had recently, I'd be remiss if I didn't ask you about the situation at HUD and what's going on there with the shakeup there and in their new policies and the impact on operating and creating supportive housing, which I know is at the heart of your mission. Uh, can you give us a little update on what's happening there and some of the impacts, some of the concerns that you have about that?
Sure. And just for the benefit of folks who are, listening to the podcast, the type of housing that we provide, almost our entire portfolio is what we call permanent supportive housing, right? And that type of housing is for very low income individuals. The eligibility threshold is the 30% AMI, it's 30% of the area median income. But for most of our residents, they are well below that in terms of their annual income, right? Many of our residents average about $500 a month of income, right? So the reason it's called permanent supportive housing is that it is intentionally designed to be housing opportunity for people who are moving from homelessness into housing stability. And many of the folks who are experiencing homelessness have some other disabling condition that requires service, right? So many of our residents self-identify that they have a mental health or behavioral health condition. Many may have physical fragility or medical conditions. And then substance use disorders, obviously an issue for people who are experiencing homelessness, right? And so what permanent supportive housing does, with this philosophy that the best way to move somebody out of homelessness is to get them into stable housing and then provide the wraparound services that an individual needs to be successful and to stay housed, right? And I think that that model works really well. 90% of our residents are staying stably housed or moving into another form of independent living, right? I think that's a pretty significant success ratio. And it's worked for a couple decades, right? Not just for us, but for the industry that provides permanent supportive housing. What the administration is proposing through the HUD changes is moving away from that philosophy. And I would say it's completely turning it on its head, right? And saying that people will only be eligible for housing if they meet certain conditions. So, requiring people to accept treatment or requiring people to do to move towards employment, some of those issues. And, the challenge that we recognize is that we're meeting people where they're at. And often when somebody is unhoused and they're homeless, whether it's sheltered or unsheltered, they're focused on survival first, right? And they're still dealing with whatever additional challenges that they have. And often they are not ready to accept those services because they're so focused on just meeting that basic need of staying safe and trying to stay, frankly, alive, right? So once you get them stably housed, then they'll accept services. But suggesting that somebody is ready for services before they have that basic sense of safety and stability is going to really complicate the ability of providers to meet the need that's out there. The second thing about what HUD is proposing to do is dramatically altering the funding that supports this type of housing and moving people out of homelessness. In fact, the analysis that's been done by a number of national coalitions on homelessness is identifying that the changes in funding, the reductions of funding towards permanent supportive housing, have the potential of putting 170,000 people nationwide back into homelessness, right? And that's just it's devastating. And I think that our reaction to this is that it is, what they are proposing as solutions is really a simple response to a really complex issue, right? And so, what we're doing right now is working with a lot of our peer agencies and housing advocates to have Congress step in, right, and basically undo that action and make sure that we can preserve the housing for tens of thousands, if not more than that, across the nation.
Well, it's a very important issue, and I wish you well with that. Anything else you're working on these days or would like to highlight before I let you go?
Well, the other piece of that spectrum is the homeless services themselves, right?
Mhm.
And I think we're the largest full spectrum service provider in the homelessness continuum, right? From providing day and night shelter to getting people into housing. Um, and the challenge that communities are experiencing right now with increasing homelessness is really problematic, right? And homelessness is increasing, and there are multitudes of reasons why that is happening. It isn't simply the individual responsibility, right? Because I think a lot of people look at somebody who's experiencing homelessness and feel that it's probably some set of bad life choices or circumstance that led them there, right? But there are a whole lot of other contributing factors. Just the economy is a primary one, right? We were just talking to one of our residents who's been living with us since about January of this year. She's about 70 years old, and never anticipated in her life that she was going to be homeless. But, decreasing income in retirement and increasing costs of living put her into that position, right? That's really a hard place for somebody to be, especially in their elder years when they've never had to confront that situation before, right? So, I like to tell people, if you've met one individual who's experiencing homelessness, or you've heard the story of one individual, that's one person, right? And there are a lot of reasons why people are finding themselves homeless. And the economy right now is a primary reason. Increasing cost of living, increasing cost for food, lack of insurance. All of those costs come home, and people have to make really, really difficult choices about whether they're going to pay their medical bills, whether they're going to pay for groceries, or whether they're going to pay their rent, right? And uh, it's not getting better right now. So the thing that I really hope people appreciate is that it really is going to take everybody to lift the boat here, right? And so if somebody's wondering what they can do to help, identifying an agency, and my preference would be Catholic Charities Twin Cities, but there are a lot of organizations working in this sector. And, if there's something that you can do to contribute dollars, or contribute, whether it's food shelves or other places, donating food, or volunteering your time, because, we only are successful because we have 4,000 volunteers every year that help us do this work, right? So it's really hard work. We are incredibly appreciative of the support community that we have that helps us do the work. And if our communities are going to continue to thrive, we're going to have to continue to develop more people who are willing to step forward and help us solve the problem.
Absolutely. Well, that's a great message to close on this holiday season, helping our brothers and sisters in need. And thank you for your part in that, Jamie. And it was great talking to you. So
Yeah,
wish you
Brian,
well.
thank you for giving me some time to share the Catholic Charities Twin Cities story and really, I think, shine some light on what is a really important and urgent issue right now. Thank you.
Absolutely. Thank you, and have a good day. We'll talk soon.
Thank you.
Yep. Bye.